According to an ancient Indian legend, there was a learned guru named Atreya, and he had a student, Jivaka. After Jivaka had studied medicine with Atreya for many years, he asked his teacher if he could go to the people and help them. Atreya said, "Let me give you a final test. Go out and search an area 8 miles around our ashram and collect all plants which do not have any medicinal value." The student went out and examined every plant he found. He tasted the fruits of some and he examined leaves and flowers of others. Finally, he came back, bowed down, and sorrowfully said, "I could not find a single plant which does not have any medicinal value." Atreya, very pleased, blessed Jivaka and told him that he was now ready to go to the people and help them. Ayurveda is an ancient traditional healthcare system of India. Literally, it means knowledge of life, a knowledge that was systematically compiled over a period of 3,000 to 5,000 years. Ayurveda teaches that health is maintained by keeping all bodily entities in balance, and Ayurvedic healthcare practices are woven into the daily routines of the people. Imbalance or overbalance of bodily functions results in illness. Ayurvedic treatment with efficacious plants, minerals, and animal products is believed to restore balance to the body, and thus to restore health. Ayurvedic treatment attempts to restore the health of the whole body rather than to suppress disease symptoms. Last year, an expedition sponsored by Earthwatch spent 6 weeks in India learning about Ayurvedic medicinal plants. The expedition was composed of 25 scientists, doctors, and volunteers from the United States. It was assisted by 15 Indian botanists and Ayurvedic doctors who are known as Vaidyas. The group studied medicinal plants and their uses in the Gir forest and Mount Abu of Western India. Dr. Narayan Patel, leader of the expedition and researcher at the DuPont Company.
The object of the trip was not to do anything but just to go there as a student and learn. We did not know what we were going to find. We did not know what we were going to prove or disprove. So this first expedition had only one goal, and that was just to be ourselves, learn. Let the people in India teach us what they have practiced over centuries.
India is a country of 800 million people. 80% of the population live in villages, where the people earn their livelihood by working the land. This closeness to the earth has led to a deep appreciation of nature. The majority of Indians are hard-working, dignified, gentle people with strong family ties. Their cultural and religious heritage goes back many centuries. Religious practices are seen as an integral part of their mental and physical well-being and are traditionally tightly interwoven. Out of this culture has emerged Ayurveda. The birth and growth of Ayurveda entailed two very distinct contributions. The Aryan race came to North India and employed tools and techniques to till the land. In fact, Aryan means one who opens the land and sows the seeds. On the other hand, the non-agrarian Dravidians in the south contributed their knowledge of plants, trees, and natural materials to the development of Ayurveda. Bapalal Vaidya is an 88-year-old revered Ayurvedic doctor.
There was a golden period for Ayurveda from 6000 BC to 700 or 800 BC, a very long period of golden history of Ayurveda. Then came the Samhita Yoga, the compilation age, and Charak Samhita and Shusru Samhita, both old treatises on Ayurveda, were published between 7 and 800 BC.
Ayurveda became and remained a major human health care system for many years in India. It lost its importance during the British rule, but was later revived, and Kilpaukay College was founded on the basis of a government report in 1923. This was followed by the Benares Hindu University, founded by Pandit Malaviyaji. Today there are nearly 100 Ayurvedic universities and colleges with attached hospitals and research facilities. Thus, Ayurveda has been established as a bona fide discipline rather than a nature-oriented folk medicine. Dr. Hart Achenbach, a cancer surgeon at Hunt's Memorial Hospital, Bedford, Massachusetts, and a staff member of the expedition.
So we tried as hard as we could to keep an open mind, to see what they were doing, and if possible to ask questions to throw further light on it as gently as we could without any hint of condescension or anything of the sort. That's a very difficult thing to do because you constantly are comparing and making value judgments, and frequently before you really know what it is that they are trying to do.
Each morning, the Earthwatch expedition collected plants with local Ayurvedic doctors and botanists. Some volunteers recorded botanical information on these plants. Others photographed the plants in their natural environment, and still others collected specimens of each plant for use in preparing an herbarium. In the afternoon, the group met to process the plants they had collected. A botanist gave the correct name, and a Vaidya listed its medicinal uses. Then the plants were pressed to be later mounted and donated to various scientific institutions in India, the United States, and England. Ayurveda's knowledge of the curative properties of plants provides the basis for the treatment of many diseases. Many of our present pharmaceuticals originated from natural products. Compounds like reserpine as a tranquilizer, digitalis for heart disease, curare for nerve and muscle ailments, opium, codeine, and morphine as painkillers, quinine for malaria, salicylic acid as an analgesic, and vincristine and vinblastine for the chemotherapy of leukemia are but a few examples of medicines originally isolated from plants. Deforestation and urbanization have taken their toll of some species. At Anand Agricultural Institute Experimental Station, attempts are being made to use modern plant culture techniques to replenish the dwindling supply of certain plants. Dr. Dalal, a scientist trained in the United States and the leader in developing techniques to mass culture medicinal plants.
We are interested to find out those medicinal and aromatic plants which have potential to be cultivated in this state.
Glycyrrhiza is a fast disappearing plant, but it is in great demand because of its many uses. At the Institute, plants are propagated by means of tissue culture. Vigorously growing seedlings are cut and transferred into a sterile nutritional medium where they will be incubated until roots begin to sprout. When they have taken root and started to grow, they are transferred into soil. They are then distributed by the thousands to farmers for cultivation. Farmers are being encouraged to raise such crops for the stolons, or underground stems, which are sold to pharmaceutical manufacturers. Traditionally, Ayurvedic medicines were prepared on the spot by Vaidyas, specifically for the treatment of each patient. Today, the preparation of Ayurvedic medicines is a well-established industry. Ayurvedic pharmacies range from small rural ones to one of the largest in the country, here in Bombay. Here a quath is being prepared. A quath is a boiled decoction prepared from several plants. Several of the medicines are prepared by grinding and pulverizing the plants, which are then made into paste. The pastes are used to prepare pills, which are then graded and packaged. Here, metals and other toxic materials are converted into oxides, known as bhasmas. Various plant extracts are blended with arsenic, lead, or mercury, and then heated in a way that produces compounds and mixtures which no longer have the toxic properties associated with metals, but which do create or retain medicinal activity. The drugs are extraordinarily complex in their composition, some containing a dozen or more different plant preparations. Each plant product in itself is a very complex mixture of biologically active and inactive substances. The concept that the activity of a mixture may be greater than the sum of the activities of the components is one important aspect of Ayurvedic pharmaceuticals. The synergistic effect of one drug on another has not been well studied in Western medicine. Such an approach to pharmaceuticals involves little synthesis and practically no isolation, purification, or expensive processing or packaging. In addition, less costly labor and very nominal prices charged by physicians make Ayurvedic medicine and treatment considerably less than that of the West. This is very important in a country where the average per capita income is extremely low.
The cost of the Ayurvedic drugs are far below compared to the allopathic drugs. I'll give you a simple example of our own. We are today manufacturing goods or selling goods worth rupees 5 crores. But when I compared with the balance sheets of other companies who are only manufacturing allopathic drugs, the quantum of the tablets, liquids, and other things produced by us and by a company which is having a turnover of about rupees 20 crores are the same. This itself will give you an idea how cheap the Ayurvedic drugs are.
Dr. Charles Leslie, Professor of Life and Health Sciences, University of Delaware.
The main strength of Ayurveda is that it's intimately related to the whole fabric of South Asian culture. The ideas of the body, the ideas of appropriate behavior to maintain cleanliness, the ideas of good diet, the right kinds of exercise and sleep and daily regimen. So it's a medicine appropriate to one of the great civilizations.
When members of the expedition asked about the availability in rural areas of allopathic or Western medicine, they were told that Indian doctors who were trained in allopathy do not want to practice in rural areas.
Now, I agree that allopathic doctors, they are not very much willing to go to very small villages. The reason being that in India, as the condition prevails, there is a lot of poverty, and as because of poverty in the various villages there are no good schools. The standard of living is not also good. At certain places there are no electricity, and there are not proper drainage. As India is a developing country, I personally feel that after a few years, large number of the allopathic doctors would definitely go to the villages as they already started moving up into the small villages in last 20-25 years, as the India has developed considerably in the last 20-25 years. But as the village would develop and other facilities would be available, as any human being, not only an allopathic doctor, but anyone, wherever the facilities would be available, they would try to move. So it is not only for the allopathic doctors that they don't want to go to the villages. They would go to the villages provided they are given sufficient amount of salary. Secondly, they find there is a good scope. And thirdly, they would find that their standard of living can be well maintained. And as the time would pass, there would be more and more of a, say, competition. So fewer and fewer doctors would survive in the bigger city, and they have to move to the villages. So it is not like that, that the allopathic doctor does not want to go to the villages. They would like to go to the villages provided the facilities are available.
Although most Ayurvedic medicine is practiced in rural areas and is dispensed through pharmacies like this, there are also many large, well-established practices in urban areas, such as this one.
There are many claims that Ayurvedic pharmaceuticals have no side effects, but there is some research done by the Central Councils for Research on Ayurveda and Siddha medicine and the Central Council for Research on Unani medicine. That's the Muslim system widely practiced in India and utilized by both Hindus and Muslims. This research rather shows that there are some side effects to many of these herbal medicines. One would expect that. So a blanket assertion that there are no side effects to our medicine is simply not true.
The Ayurvedic doctors do not have any basis to claim whether they have fewer side effects or not. It's just the mere observations that any time they treat their patients, they watch and monitor them very carefully, and they do not find any side effects. So when they read in scientific journals or in newspapers that the Western medicines have side effects and many of these drugs have been retracted from the market, and so they feel that there is something which is different in their system, which is much more attractive, or one should learn and find out why their medicines do not have the side effects.
One question raised in discussing efficacy and side effects concerns the placebo effect.
I think it's hard for us to conceive here how much mysticism influences everything in India. I think if you go there for 6 weeks, as we did, you begin to get a small feeling of the fact that everything throughout business, banking, manufacturing, and medicine all has its mystical components. If you go to a businessman's office to talk to him about something, on the wall across from his desk you may well see a picture of his guru, and on the floor is a little altar with some incense burners. Certainly that is not something you see in the boardrooms of America.
Now when they go to hospitals, they carry these beliefs with them, and many times we had wondered whether or not believing in something will have a different effect. If you may consider or think about placebo type of effects, and we had wondered many times whether or not just thinking about something affects and changes your physiology or biochemistry, and I have used often a word like molecular theology. Now if you go to a hospital and you already have a belief that a particular medicine is going to cure you, now the cure which you might have, is it due to the chemicals themselves or your influence in controlling and regulating your own physiology and biochemistry? And so when somebody wants to do, for example, large scale study and want to evaluate how these drugs are going to work, we wonder, should we keep in mind this type of placebo effects?
In some illnesses, it's easy to see improvement. These photographs show a disease known as leukoderma or vitiligo. This non-contagious illness is characterized by a cosmetically devastating depigmentation of the skin. Although it has been treated by both allopathic and Ayurvedic doctors, its exact causes are unknown. Allopathic medicine has no good cure for this condition, although treatment with certain chemicals coincided with a repigmentation of the skin in a low percentage of cases. It is not certain whether repigmentation occurs in these cases as a result of treatment or not. It appears that those areas of the skin over bony prominences, like the knees or knuckles, show little, if any, response to allopathic treatment. This before and after photograph shows a dramatic improvement in the vitiligo of the patient treated by the Ayurvedic doctors. Most importantly, the improvement occurs in an area over the knees, an area which would be least likely to show improvement as a result of Western medical treatment.
Every time you go and visit an Ayurvedic hospital in India, you ask a question, why did this patient come here? And their answer invariably would be that because nobody could cure, particularly the Western medicine or treatments cannot cure him, so he came here. In fact,
exactly, it is correct. Some diseases are such that can be cured very nicely by Ayurvedic medicines, wherein allopathic medicines are failed. As for examples, it is these piles, rheumatic arthritis, asthma. There are so many diseases which can be cured by Ayurveda very easily, where these medicines, allopathic, are failed.
People commonly ask whether Ayurveda is efficacious. Of course it is, but every medical system is efficacious. The real question is, for what and when is it efficacious? Most patients who consult physicians in India or in the United States will get well. This is 85 to 90% of the cases will be self-limiting illnesses. What the physician can do may help the patient, but if the physician does nothing, the patient will get well anyway.
Ayurveda presents the Western observer with a bewildering number of medical claims. In allopathy, correction of far or nearsightedness is normally done with eyeglasses. Ayurvedic treatment, as seen here, applies medicated oils to the eyes. A young girl came to a Vaidya who was traveling with the expedition. She wanted treatment for a foot condition known as tajagarmi, which means excessive internal heat that causes the skin to crack. The condition was so painful that she couldn't walk. The Vaidya prescribed both internal and external medication with a strict dietary regime. 2 weeks later, she returned to the expedition to show the marked improvement in her feet. She was again able to walk without discomfort.
One of the very interesting episodes that we experienced was a doctor who was in the outpatient department who stated that she could change the sex of a female infant to a male infant in utero. In India, where male infants are much more highly prized than probably other parts of the world, this is a very important thing. So we pursued this to some extent. One of the questions we asked her was, how did she do this? She said that what she did was to take the sap of a certain fig tree and instill 2 drops of it into the right nostril of the mother, and then she gave the mother some seeds of a small gourd-like plant. She gave her 6 of these seeds at the same time that she used the sap of the fig tree. And I asked her how many times one had to repeat this, and she said, oh, you just have to do this 1 time. So I said, well, there must be a time limit on when in the pregnancy you can do this. And she said, oh yes, you have to do this before the patient is 6 weeks pregnant.
Influencing the sex of an offspring is also practiced by a number of physicians in the West. In such cases, the sex of the offspring can be statistically skewed towards male or female children by separating the sperm carrying the X or Y chromosome prior to artificial insemination. But the Indian doctor's claim is quite different than this because a change in the sex of the actual fetus is suggested. Although the claim may sound sensational, there are possible ways that such transformation might occur.
Of course, like I said, I had reservations, but when I looked at the plant was one of the ficus or a fig family. Now, it is known in the scientific literature that it contains a compound known as a sorlan. Now, sorlan has the ability to nick and break the chromosomes.
Such a transformation might be caused by hormonal influences, since hormones are known to influence organ development, and certain plant substances have been found to have hormonal activity. If Western medicine is to benefit from a study of Ayurveda, we must abandon a mindset which seeks acceptance or rejection of the whole system. Rather, each claim must be examined on its own merit. Those which measure up to Western criteria of efficacy should be studied further. Those which cannot be substantiated may be dismissed.
And you always think and pause for a while and see really how much should I believe. And my answer to that would be, well, first let's learn and then we'll test it. If it stands our test and their test, then we will maybe believe and will start accepting it. But we need very rigorous testing and evaluation of any and all of their claims.
We went to India, and when we went, people said, are you going to go there to teach them our methods of medicine? And we said, no. We are going there to learn. And this is what we did. And when we were there, people said, are you learning what you expected to learn? And we said, we didn't come here with expecting to learn anything particularly. We came here to look at what they were doing as best we could and see if there were things that we could use or were useful. And that's what we did.
Bapalal Vaidya, who has been a guiding force in Ayurveda for the last 70 years, feels that Ayurvedic medicine should integrate itself with Western scientific medicine.
Now, we Vaidyas want to know about the scientific medicine up to date also. They want now anatomy, surgery, midwifery, toxicology, everything to know from a scientific system of medicine. And let us hope that by combining or by taking whatever is useful from any pathy would be beneficial to Ayurveda. Personally, I think that all the olden Indian sciences should be illumined by the modern scientific methods, by the modern science. Unless that is done, Ayurveda would be no more. So now we have been taking the help of the present medico also. So this is about the future.
India was an experience. It was sharing, it was learning. They opened their arms to welcome us and opened their hearts to accept us. We uncovered no great truths and made no scientific strides. We just had a glimpse of Ayurveda. No one can learn in 6 weeks what they have gathered over 6,000 years. If anything, we may have opened the doors for future cooperation between allopathy and Ayurveda. And like we know in grain from chaff, each medical approach can sift what is useful and applicable to itself from the approach of the other. The truth has many facets.